Okay, good afternoon, everybody. My job today is to introduce you to Froedtert Health and really give you some context for the more important stuff that John's going to come up here and talk to you about in a little bit, about some of the work that he's doing in our organization to really help lead some of the change that we're trying to do. Just a little bit of background about Froedtert. We're a $1.4 billion health system located in Milwaukee, Wisconsin. The largest component of our health system is our acute care platform. We have 3 hospitals. Our largest flagship, Froedtert Hospital, is a 500-bed academic medical center teaching hospital located right in the middle of the metropolitan Milwaukee area, just west of the city. We have 2 community hospitals, Community Memorial about 8 miles northwest of Froedtert, and St. Joseph's in West Bend about 30 miles northwest of Froedtert. Another component of our health system is our community physician platform. And we, like many others, I was resonating a lot with Tim's presentation right before here, we're kind of putting that together. Today, we're actually organized in 2 different medical groups. The Froedtert Health Medical Group that is employed by the health system, it's actually 2 legacy multi-specialty physician groups that we put together. As you can see by the statistics up there, over 100 physicians, 16 locations, located primarily in that northwest geography, admitting to our 2 community hospitals. We also have a joint venture called the Clinical Ventures Group with the Medical College of Wisconsin. We are the academic medical center. This was started as our primary care base coming out of the academic medical center, located in the central market, moving into the southwest, admitting primarily to Froedtert Hospital. We also have, like everybody else, home health, dialysis centers, and other types of ambulatory joint ventures and healthcare operations in our health system. Froedtert Hospital is the major teaching affiliate of the Medical College of Wisconsin. We are Eastern Wisconsin's only academic medical center. That effectively means that the 800 medical staff at Froedtert Hospital are all on faculty at the Medical College of Wisconsin. We are the primary teaching site for 350 residents and fellows and literally hundreds of students. Not only the medical students from the medical college, but also nursing students and allied health professional students from colleges and universities all over the Milwaukee area. We're very proud by much of the recognition that we've received. One of the ones, just to point out a couple, Froedtert Hospital has actually been recognized as the most preferred hospital in Milwaukee for 8 years in a row now. You could say at Froedtert Hospital that the patient is in the DNA there. I'm a new CEO, so I didn't create that. I inherited that, but that's a wonderful base to build on. In addition to that, we've also had national recognition by U.S. News & World Report. And one of the things that really John will talk to you about is recognition as a top workplace in Milwaukee. And that's not as a healthcare organization, that's actually among all large employers in the area, so we're quite proud of that. We, like many other people, though, are working on a lot of things, and a lot of the things that Tim talked about really resonated with me. I'm a relative newcomer to Froedtert. I've been there a little over 2 years. I've been the president for a little over a year and just became the CEO. And I followed a very, very successful CEO who built the place. So when we say we have a vision statement to be the region's premier health system, in many ways, as you can see from our recognition, in many eyes, we already are. But we also know that if we're going to retain that or attain it in the future, we have to do things a different way. And our vision statement that we created over the last year really sets out the 3 primary ways that we're going to do that. The first one is to demonstrate superior value. That means we need to prove it on publicly reported transparent metrics. We need to do it better than anybody else, and we need to do it for reasonable cost. And you can imagine an academic medical center that's lived on reputation for quite a long time, that's a change. So that's something that we need to change as we go forward. But we're also going to build it around what makes us unique. Because our academic community partnership, we are the only health system in Milwaukee that can link, actually in the whole eastern part of the state, that can link an academic medical center to a community-based network of care. And we believe that gives us the ability to really perfect the right care at the right time and at the right place to be able to demonstrate superior value. Our bold statement is that we're going to use that to align healthcare delivery across the region. We're located in Milwaukee, but we are the tertiary medical center for the whole eastern side of the state, and we believe and know we need to get bigger and play a different role. We look at a whole different way of variety to do that. Some of that will be an expansion of our own footprint. We're expanding in some new markets in Milwaukee. Some of that's through unique partnerships that we have, quite frankly, with health systems we sometimes compete with in our own area, or across the Eastern region with 7 other healthcare organizations that we have together in our Accountable Care Network. So with that, I'm going to introduce John Pandl. John is our Chief Learning Officer for Froedtert Health, and he'll talk about some of the things that he's been leading that are going to help us achieve this vision. John.
Thank you, Cathy. I'm going to pick up where Cathy left off and talk about our leadership development and how that is contributing to build a workplace of choice. So I want to start with our model for leadership development so you can see how it's really aligned with our strategic priorities. On the left-hand side are the organizational drivers for development, which are our mission, vision, and values, and our strategic plan and priorities. And then on the right-hand side are more of the human resource-driven drivers, starting with the Leadership Academy, which is the box just to the right of the center box, and that's the primary teaching vehicle for our leaders to learn the competencies and skills to be successful. And then other components include individual leadership development planning, career planning, and the performance management system. In the box in the center represents the accountability for leaders and how their performance is measured, which is built around our competencies for leaders and the goals, the accomplishment of their goals. And the goals are again tied back to our strategic plan. All of this is built on the platform of performance excellence, which is how we conduct our care and business throughout Froedtert Health. And there's a really strong emphasis on the patient. The patient is the center of what we do, and our service to our colleagues, our staff. These are the leadership competencies. They fall into 7 broad category areas. Within each of these areas, there are specific behaviors that leaders are accountable for. So for example, in service management, leaders are expected to use a scripted introduction when they meet new people, and they're also accountable for their staff so that they utilize that, particularly when working with patients. In the area of business accountability, leaders are expected not only to create and manage their budgets, they're also expected to utilize data for cost savings to create better value. In conflict management, leaders are expected to avoid triangulation, which is where they get into the middle of disagreements or conflicts with their staff. They're expected to teach and coach their staff to work out differences between them before they come to the leader for assistance. In relationship management, our leaders are expected to round on their staff monthly and ask specific questions that, if they are addressed promptly and regularly, they contribute to high retention over time. Our strategic goals are really what are driving our healthcare system to success and bringing our vision to fruition. They're displayed in a tool called the Strategy Map, which is a 1-page document, and each of the 5 strategic priority areas of service, quality, people, finance, and growth have a box, and in the box are the actions that are identified. There's a strategy map for the entire system. There's also one for each entity, and then the goals are cascaded down to all of the leaders, and their goals will support the goals for each entity. The ultimate is to create the best possible patient experience, and we also recognize that it's our staff who create that patient experience. So supporting our staff is another key role for our leaders. The Leader Evaluation Manager is a tool and application where the goals are loaded for leaders. They create 90-day action plans, and then they input metrics as the data becomes available to show progress towards their goals, and they use this in their monthly meetings with their leaders to keep the leaders appraised of their progress. Our leadership development program, again, is based on our performance excellence philosophy. The Leadership Academy is the key vehicle for learning, and all of the classes in the Leadership Academy are built around those 7 competency areas I showed you earlier. We have face-to-face classes, online classes, and we also have coaching available to leaders through the organizational development staff. And so all of the alignment with the learning and the goals and the learning evaluation manager, all of these things together build accountability for our leaders and increases the importance of them to be learning the skills that they need to be successful and accomplish their goals. The primary audience for the Leadership Academy are 425 or so formal leaders with the titles of supervisor, manager, director, and vice president. We also have about, there are, in addition, let me get my thoughts together here. We have newer leaders who have less than 5 years of experience are the heaviest users of the Leadership Academy. And in the last year, we have created a certificate for performance excellence when leaders accomplish 9 courses in the Leadership Academy around our performance excellence initiatives, then they get this certificate. We also have 100+ aspiring leaders who are frontline staff who are taking classes in the academy because they're interested in a leader role or their leader has identified them as someone with high potential. Physician leaders at this point are a smaller group of participants, but we're looking to ramp this up as we go forward into the future, building more capacity with our physician leaders. Our initial investment to get the whole Leadership Academy up and running was about $450,000, which included all of the OD staff, supplies, purchase services, and expenses. Our fixed expenses on an annual basis for vendors that we work with for things like 360 evaluations runs about $25,000 or so aside from the salaries. We also have a lot of leaders who are out of the OD department who teach classes in the academy, and their time is in addition to this figure. When we introduce new curriculum, we will work with an external vendor oftentimes and then do a train-the-trainer approach and incorporate that into ongoing classes in the academy. Another thing that is important in our culture, the leadership is more top-down to the staff. We also recognize that our staff have got a lot of passion and creativity. And so we use affinity groups, which are frontline staff who are organized around particular strategic priorities, and they become the resource in their particular department to work with providing information, education, recognition, and they partner with their leader. So this gives them an opportunity to have some experience on a limited basis with testing out their leadership skills. And currently we have those in our customer service champions, inclusion advocates, and green champions, which are working on recycling. And then we have shared governance across our system in nursing, which gives nurses the ability to plan and direct how nursing care is delivered through unit-based and divisional councils, which are all nurse-populated and led, and assisted by nurse leadership at the division level. And then one last thing that isn't a slide, but we utilize a lot of our frontline staff for major communication around our strategic priorities. So oftentimes we'll be creating a video or a poster campaign, and we include staff who get nominated by their leaders to participate in these various communication tools. This gives them visibility. It's an opportunity for recognition for them, and our staff really like to see their colleagues in these various communication vehicles. Now I'll talk a little bit about some results and outcomes. This slide here shows a progressively increasing recognition as an employer of choice by various publications in the Milwaukee area. The last 3 years, we've been recognized as a top-ranking healthcare employee. We were the 4th preferred large company as an employer last year. We also received a special award in the manager specialty where we had the highest score on 4 manager questions of any employer that participated in this survey. And then we were also nominated by the vendor that conducts the survey to an inaugural list of national top workplaces. So this information is widely distributed in our community, and it's one of the things that is a draw for people to come and work at Froedtert Health. Some other results that I think are significant, and they fall into a number of our different strategic priority areas. We have a triple or double A- bond rating, and we've been able to maintain that all the way through the last several years of the economic downturn. This comes with a tremendous amount of teamwork across the entire organization, working on all different issues related to our financial management. We have rising staff engagement scores. We're now at the 81st percentile in the national database with the vendor that we work with. Froedtert Hospital, which is the largest in the system, is in the high 80s, and we're on track to get to the top decile in the next few years. Froedtert Hospital received a designation from the University Health System Consortium Quality Ranking this year, where they moved from the number 23 up to number 12. This ranking is based on about 50 different metrics that are all combined together into one quality rating. And about 80 of the 100 or so academic medical centers across the country participate in this particular quality ranking. Our HCAHPS top box scores are among the highest in southeast Wisconsin. They're above the national and state averages, and typically our 3 hospitals and are 3 of the top 4 among the full care hospitals, full service hospitals in our region. Some of the success factors that we feel are contributing to this are the high degree of leader accountability for staff engagement, action planning, and improvement. So all of our leaders are expected to create action plans around their annual staff engagement data. Those leaders who have lower scores are required not only to meet with their next level leader, but also with their vice president. And they have to discuss the results and discuss some of their action plan ideas with their next level leader and their vice president. And then at that time, they get referred to a coach to work with them to help them present the results to their staff and to identify what are some of the key actions where they can get the most leverage and results in working with their team. Another thing the coaches work with around staff engagement is helping the leaders to identify issues that they can work on that will strengthen the relationship that they have with their staff. We have a wealth of educational offerings for our staff and leaders across our organization that will build up and develop their skill set. And that creates a commitment to the organization by staff taking advantage of the many opportunities that are available to them. We also have a lot of vehicles to communicate with our staff about what's going on in the organization. Cathy conducts updates on the strategy, and she goes to every entity in the system and gives them updates and fields questions from them. We have facility updates, HR updates, and so there's a lot of opportunities for staff to get information about what's going on and see progress towards our goals. And then one other one that I think is important is that as an organization, we're very dissatisfied with the status quo. We have a culture of continuous improvement. As good as we get, we're always looking for the next opportunity for improvement. And so, we're on this journey. We also, our goal ultimately is to be in the top decile in all of the metrics that we use for our various strategic priorities. And, we're well on our way with that journey. And then one other thing I want to mention, going back to the patient experience. This is something that is, as Cathy mentioned, is front and center in our organization, and we recognize that our staff are the ones who create the patient experience. And so that's why we put a lot of effort with our leaders, especially our newer leaders, around service and around staff engagement, because those two things are so critical in terms of creating that patient experience. Some of the barriers that we're facing are similar to ones that all of you in the room encounter, that our environment around us is constantly changing. Internally, we're orchestrating a lot of change, and the accountabilities and the expectations for us are rising all the time with financial pressures. One of the things I've recognized is we need to expand our coaching capacity across the organization. Leaders really learn when they're out there actually doing the work and applying what they may have learned in a class or some other learning event. And having a coach available to them has been very effective in our staff engagement. We think it can be just as effective in helping them managing their budgets, and helping them in other areas. So we're looking to expand this and utilize a lot of other leaders, giving them coaching skills and then helping them to be coaches more formally with other leaders. We're also looking at revisiting our competencies and creating a more focused curriculum in our Leadership Academy. Next steps, actually everything on this slide really would constitute the bottom point of a human capital strategic plan, which is really, where we're going. And I think the topic of this conference was very relevant for us because we have a number of things in place, but there are things that we need to create that aren't there, and there are things that we need in the very short term that are very important to us that are imminent needs, like further developing our skills for our clinical and other leaders around business and financial capabilities. So we're working on that with our Leadership Academy. Physician leadership development is another need that we're just getting involved in. It's going to be very pressing over the next few years. And then succession planning. We've laid some of the groundwork in the last year. We did a study of our entire workforce, and we have identified those job categories where we're at risk for a high percentage of retirements in the next 5 years. And one of them, of course, is our leadership team. So we have to be looking at building and creating the leadership team for the future and growing our leaders from within. I think we do a fairly good job with new leaders, getting them ramped up in the first couple of years. Now what we need to do is look at our mid-level group of leaders, our directors and our managers, and start preparing them to be moving into higher leadership roles in the future. So that concludes the presentation. Thank you very much for your listening, and we do have about a minute or two if there's any questions. Yes?
Joni, Cathy, thank you for sharing your data and your journey. It's been beautiful. One question, honing in on coaching. I learned a very difficult lesson at the Cleveland Clinic, and I'm wondering if you had the same experience. Are your coaches internal or external?
Right now, they're all internal. And
you don't have a difficulty with confidentiality?
We do have a little bit, and actually, that's a good point. I'm starting just to look at exploring some external coaching resources. I think that most of the time it's not an issue, but there are some occasional situations where that does become an issue or a concern with the person being coached. So that's a good point. Thank you. Any other questions? Yeah. I think Cathy's good.
I would say it really resonates with what John said about Froedtert's whole accountability structure. We're just very hardwired around accountability. And so when the real struggle we ever have on our bond rating is operating performance. We have a very solid balance sheet. And there's immediate attention paid if you start to veer off and you get back on plan. I mean, it's just, you do action steps. Same thing, quite frankly, happens if we start to see you veer off on patient satisfaction or your engagement scores. As John talked about, it's hardwired throughout the organization, and so we just get up on it very, very quickly.
Okay, well, I think we've got 20 seconds left, so I think we're done. Thank you very much.